So that is how we can get to the masses, because through WhatsApp AI automation, we can do a lot of assistance for patients to get the right kind of information, right kind of assistance, right kind of appointment bookings, right kind of platform to give and provide solutions, right kind of platform to connect virtually, right kind of platform to also not only get the pre-consultation and the appointments booked, but also post-consultation, daily care, support systems, all of that. And that is possible through a lot of messaging, which can be pushed through WhatsApps after getting consent. So all we need to do is like to think about, see, when we are developing technology, it has to be like user centric, as I've told before as well. We have to think about how the end user will get benefited and how, in which way we can get to them. That is very important. So I think WhatsApp has got a great potential in getting to that. But at the same time, if you look at sustainability and like ROI centric perspective for the healthcare organizations, it's also like not very expensive these days, because like if you talk 10 years back, we used to do million-pound projects in AI for simple systems. But now things have evolved a lot, and there's a lot of scaled operations which can be done at a lesser cost. There are now data centers available in India. You can be utilized. There are like a lot of technologies which have become very really cheap in terms of users, because the model has changed. It's coming as SaaS now. So SaaS models are much more useful in those areas.
Understood. So very interestingly, you touch a point like the cost effective and the sustainability point of view. Now, I just want to know, we will talk about the sustainability and all those things. One thing is from like the data privacy and all. So everybody, I talk to everyone like how the data privacy and all this, how to ensure all those things. So
Hmm.
how do you work and how do you see like as compared to, for example, I just want to get in touch or want to touch like the Indian perspective and the outside India, the international one. So do we have some kind of data privacy security things like
Definitely, and that is very important, because see, in healthcare especially, we are dealing with very sensitive data. It's not only personally identifiable information; it's a lot of personal information, and invasion of that is not really good. So we have to be very careful about how we're using technology to implement about the larger good, but at the same time, how responsible we are in terms of like preventing the data from getting leaked out, or like managing the data in a way that is convenient and at the same time acceptable by people. So we have to consider that. There are multiple regulations. For example, in EU, we have got the GDPR, General Data Protection Regulation.